Dorsal hand augmentation gains popularity in the aesthetic field. For a successful treatment, it is utmost important to have a good knowledge in anatomy, to use suitable filler material for this procedure, and basically and most importantly, use advanced techniques for this treatment. For the three-dimensional volume augmentation of the dorsal hand, calcium hydroxyapatite is a very suitable filler. Radius did prove its efficacy and safety in many studies on hand augmentation. Due to its physical and chemical properties, such as a high viscosity and a high elasticity, the volume efficacy is ideal. And secondly, due to its opaque structure, it camouflages very well the prominent veins. For the dorsal hand augmentation, radius is typically used in a mixture with local anesthetics. The approved and classical mixture for calcium hydroxyapatite is in a 20% ratio with the local anesthetic. The mixture ratio may vary up to the physician's needs. Radius for the augmentation of the dorsum of the hand is typically administered in two techniques, either the bolus technique using a sharp needle or the cannula technique using a blunt tip flexible cannula. The injection of the dorsum of the hand for a three-dimensional volume augmentation with radius shows an immediate improvement in volume on the short and the long term. Along the aging process of the dorsal hand, one can see that the dermis is thinning. Secondly, in this case, not as well visible, the dyschromia with lentiginous is appearing. And most importantly, from the filler aspect, is that we see a three-dimensional volume loss, which is visible here with the pronounced intrametacarpal spaces as well as with the prominent veins occurring over the long term. We're now showing the bolus technique for the dorsal hand augmentation. The technique consists of basically 4 boluses placed in the distal intermetacarpal spaces. The principle of the therapy is to tint the skin and place a bolus of 0.2 to 0.3 cc in the intermediate lamina. The molding should be done direction proximally in a gentle and consistent manner. It is important to tint the skin in order to find the right level of injection. Every bolus is placed individually. The goal here is to avoid the veins and to correct up to the clinical endpoint. I prefer to mold the material immediately in order to get an even distribution in each area treated. Having shown the bolus technique for the left hand of our patient, we used again calcium hydroxyapatite with a lidocaine 1% in a 20% ratio, and we used 1.2 cc as a volume for this hand. The treatment of the volume loss of the dorsum of the hand with radius gives an immediate, subtle and smooth three-dimensional volume augmentation on the short and the long term.